Hello guys, welcome to my brain wreck. So, here I'm just going to pass on some information, stuff as I usually do. As you guys all know, I have epilepsy myself. I'm going to get a 48-hour ambulatory EEG. I'm going to be doing it here at home. And once I know the results and stuff, once it's done, I want to actually go and get the machine, not the machine, but whatever they put on my head and all that good stuff. So, I thought I'd talk about epilepsy and autism, an autism link here. This is from epilepsy.com, so I'm just going to read a little bit here and stuff about it. This course, this is AI overview generated. So, it says epilepsy and autism spectrum disorder are often linked due to shared underlying causes, including genetic predispositions and abnormalities in brain development. Abnormalities in brain development. While not all autistic individuals develop epilepsy, a significant portion do, and vice versa, suggesting a complex relationship where they may have shared common risk factors. Those risk factors, I'm not sure what they are, but I'll go further more into it and see what they are here in a little bit. So, obviously they believe there's some type of link somewhere, so vice versa, epilepsy and autism, or autism, people who have autism could have epilepsy, people who have epilepsy could have autism, so they might obviously think there's some type of relationship there. So right here is going to say, here's a more detailed explanation. Shared genetic factors. So we all have parents, and our parents, we may have some type of genetic that we inherited from them, from the mother or the father, depending. I think most of our genetic stuff is inherited from our fathers. I'm not for sure, but so shared genetic factors. Studies have shown that certain genes implicated in both epilepsy and autism spectrum disorder. And just to pass on, I'm not a doctor or anything, I'm a medical professional, so seek all medical attention from your medical team and stuff like this. This is just for information purposes only. Some of the words I do not understand what are in here or what they mean. Alright, so studies have shown that certain genes implicated in both epilepsy and ASD, autism spectrum disorder, such as SCN2A, which I don't know what that is, I have no idea what. That's why I say seek team from your medical doctor, and HNRNPU. Some of you might know what it stands for, but contribute to the co-occurrence of the conditions. They also talk about brain structure and functions. Both epilepsy and ASD can be associated with abnormalities in the brain structure and function, particularly in areas related to neural excitation and inhibition. All right. So excitation and inhibition, you guys know what inhibition is. Some specific things are like increased risk in specific groups. So there's obviously specific groups that have an increased risk to it. So obviously, as they call people, individuals, intellectual disabilities now, which is the political correct term as they use nowadays, are more likely to have both ASD and epilepsy. And epilepsy is also more common in autistic children without intellectual disabilities. Regression and seizures. In some cases, regression in language and social skills, which can be a feature of some autistic individuals, may be linked to the onset of epilepsy, particularly in the conditions like Landau-Kleffner syndrome. So I don't know what that syndrome is, but you guys heard of what I just said, Landau-Kleffner syndrome, Landau-Kleffner syndrome, all right? So, and then treatment challenges. The treatment challenges are the co-occurrence of autism spectrum disorder and epilepsy can present unique challenges for diagnosis and treatment, as the symptoms of both conditions can sometimes overlap or be mistaken for each other. Now, for me, some people think I may be on the autism spectrum, possibly, and everybody not diagnosed as I have been or not. I do not know for sure if I am or not, but I'd have to be seen for that. Obviously, I do certain tests, I'm guessing. So, I seem to have a few people that, family and friends and workers that I worked with before, thought maybe I've been on that, just from their family and friends recognizing certain things. So, importance of early identifications. Recognizing the connection between epilepsy and ASD is crucial for early intervention and support for individuals with these conditions. Now, as I said, this is for information purposes only. For medical advice or diagnosis, consult a professional. All right. This is artificial intelligence, so responses may include mistakes, obviously. So if you guys out there know, if you have any, if you guys have children or adults or whatever that have autism and epilepsy, let me know in the comments and tell me about it if you do. If you think it's one and the same or are connected somehow by a certain gene. So all kinds of things. And of course, epilepsy, abnormal electrical firing from the brain, recurrent seizures. It says approximately 1 to 2% of children are diagnosed with epilepsy. So that's 1 to 2% with epilepsy. As for adult, I'm not sure how much it is, but anyways. So what is autism spectrum disorder? Well, autism spectrum disorder is development dysfunction involving social, speech, cognition, and behavioral disabilities. As for me, I think it was for more of my speech and stuff, and social, probably both and stuff. When I was younger and stuff, I was shy and always stayed right by my mom, or hid behind my mom and stuff. So about 0.1% of children have ASD worldwide. So I don't know if that's changed or not, but it probably has since then, since from when I was born in 1975. So in the United States, about 1.5 of children have ASD, autism spectrum disorder. And then, as I said, is there a connection? Yes, there is an association between epilepsy and autism. Children with autism are a little more likely to have epilepsy. All right. So children with epilepsy are a little more likely to have autism. So you see it goes both ways. Seizures are most common neurological complication, ASD. So it complicates things, if autism is sometimes connected to seizure disorders. We understand that seizure disorders is not always connected to epilepsy, because epilepsy and seizures are two different things. Yes, there are seizures that do occur with epilepsy, but it could be different things, or how things are determined based off your doctor's diagnosis stuff. This is, do all children with autism have seizures? No, not all autistic children will develop seizures. In fact, only a minority will. Similarly, not all children with epilepsy will have autism. Only a small minority, approximately a third of the autistic spectrum, also have epilepsy. All right, so only a third of them. So, like I said, I'm not sure what the percentage is nowadays, depending on what's going on in this world today. You never know. Now it says, are some people with ASD more prone to seizures than others? So this says, yes, some genetic disorders are associated with both seizures and autism, including Rett's, Fragile X, Angelman, Prader-Willi, and many other syndromes. Now, I'm not sure what those are, what this means, or whatever, but I'm just passing those on. You guys can look that on up into here. I'll just put the description, copy and paste the website where I got this from, which is epilepsy.com. So I'm just passing out information for those, to understand where I'm going with this. What I'm saying is I'm trying to find, like I said, I'm trying to find how I just have, if they do, because I've had nocturnal seizures, but some people told me they thought maybe I've been on the spectrum side, so that's why I'm doing this. So I don't know if I'm on the spectrum side or not, so it's possible. Because usually I usually am shy, but I've been getting a lot better at it. Obviously I talk on the camera here or whatever, and doing the best I can. And by the way, I'm trying to practice looking at the camera. Now, you see my eyes over here, right? I'm trying to look over here, so because this is where the camera is, right here. So that's why I'm trying to be more focused on the camera, where it looks like I'm actually talking to you guys. So that's what I gotta practice more of. But either way, see how my eyes just turn? My eyes are looking, my eyes are looking right here at the little camera loophole here. But if I look over here, it doesn't look like I'm looking at you. It looks like I'm looking over here reading something, but I'm not. So, but I'm gonna look over here. So, is there a specific type of seizure associated with ASD? No, there's no one type of seizure in ASD, autism spectrum disorder. Seizures can be focal or generalized. All right, so there can be a focal seizure or generalized seizure. Includes focal onset, impaired awareness. All right, complex partial. What is it called now? I think it was These be called grand mal seizures. Grand mal seizures. I guess these called complex partial now. Absence, tonic clonic, and atonic. I believe mine were clonic tonic because they were nocturnal seizures. Now, over here it's asking, are seizures in people with ASD more severe? Generally, no, but it is variable. Some seizures are easily controlled and others are intractable. So, can't be controlled or anything with medicines or anything like that. They're just going to come and happen. Now, there is a higher mortality and morbidity rate of disease. So, you're going to have a higher mortality that, you have more chance of dying. Unfortunately, morbidity rate of disease associated with seizures in ASD. So, that's pretty scary. So, people that have the autism spectrum disorder. So, that's something to be concerned about, obviously, if you're having seizures with ASD. So you might want to ask your doctors and stuff about that, or the risks about having the mortality and morbidity rate of a disease associated with the seizures in ASD. So ask your doctors about that, your medical professional, neurologist, or whoever you see. Now that says, what should parents look for? It may be difficult to recognize seizure activity in ASD because of the communication barriers and overlap of symptoms with frequent abnormal behaviors. So obviously, kids are going to have behaviors different ways. But you may know something, your kids may have something totally different, abnormal behaviors from other children. I'm not saying they're children. They're never normal anyways, right? For example, repetitive purposeless behaviors of autism can resemble automatisms seen in seizures, repeat. It's automatic is what happens. Cognitive delay, so impaired social interactions, and aggressive and irritable behavior seen in children with epilepsy can also be seen with ASD. Thus, it's difficult to discern the cause. So it's a cause. It's hard to do. That's why they like to do all these tests and stuff to try to discern it from ASD and epilepsy. And so obviously, as I said before, there's actually some type of link somewhere in between there, that have the same, they look almost exactly the same with the epilepsy and ASD, or seizure disorders. So, red flags to note for seizures. Stirring episodes, which could be signs of absence or atypical absence of seizures. Now, myself, like I said, I've only had 3 nocturnal seizures in my lifetime. At 48, I'm 50 years old now, and haven't any seizures since then. Excuse me, I had what's called a pseudo seizure brought on by stress and stuff like that. Not for sure what or whatever, but I did have a stirring seizure and stuff. I'm there. I just, people would talk to me. For example, like my wife would talk to me, and I'm just staring out into space, like. And don't know, and then I come back to reality. So stiffening, which could be a sign of a tonic seizure. So obviously nocturnal seizure. When you have a nocturnal seizure, your body's going to stiffen up and move around all kinds of ways and stuff. That's scary. Then there's a rhythmic shaking or twitching, which can be a sign of focal aware or simple partial seizures, which is sort of grand mal seizures, I believe. Was always that, if I remember right. They call them simple partial seizures now. Loss of intention. I noticed, my wife and other people noticed that in me. Loss of attention. It could be a sign of absence or focal impaired. But as I said, though, all I know is I've had 3 nocturnal seizures. I don't even think more than that. But it's possible that I've had seizures and just they weren't recognized at all and stuff, because I was just loss of attention and going somewhere else. And this could be a form of ADHD also, possibly. So I'm wondering if it's like on the autism, ADHD, and epilepsy, or some type of seizures are all connected somehow, possibly. I'm just throwing that out there. If you guys think so, let me know in the comments. So, as a loss of attention, which could be a sign of absence or focal impaired awareness / complex partial seizures. So, what can be done? Well, epilepsy associated with autism spectrum disorder does not change the evaluation or management of seizures. Medical evaluation with the brain imaging and EEG anti-epileptic drugs. What I take, obviously myself, I do take what's called levetiracetam or Keppra. You know, you've probably guys heard of the Keppra rate and stuff like that. Like, yeah, I've been okay. I mean, I'm on the maximum dose. I'm on 3,000 milligrams for the total for the day, and then 100 milligrams for the cosamine, or Vimpat, you want to call it. So, adjunctive non-pharmacological therapy can be considered if medications fail. And you'll hear this a lot in epilepsy and stuff, and for seizures and stuff. The ketogenic diet or the VNS stimulation, which I talked about in a previous video. So, some safety measures by caregivers: avoid restraining the child with large objects from the area, obviously for safety, so they don't fall, hit their head, or bump into something. To avoid injury, turn child on his or her side, ensuring nothing in the mouth to avoid choking. And they mostly say turn to your left, I guess, because I guess your organs, when you lay yourself, are more protected that way. If you guys don't realize, your organs actually do move when you're walking around and stuff like that, or, you know, while you're walking and stuff like that. Or if you're moving, you turn, your organs do move. You know, I mean, there's your rib cage in front there, part of and stuff, but not all of it. So, this was authored by Tasleema MD, University of South Florida, Tampa. It was reviewed by Selim Benbadis MD, and reviewed date was Tuesday, March 21st, 2017. So I'll put that in there to give them the credit, because this is where I got the information from. So this is just some information to pass along to you guys. Hopefully this will help you out some, or maybe to look for stuff that, you know, give you an idea. You know, if you see something, or this is all new to you, because it's still fairly new to me. It's only, you know, I've had, you know, I mean, every now I've been 2 years free, but it's still new to me. Like I said, I'm getting a 40-hour ambulatory EEG done here within a week or so. Actually, yeah, within a week. Go to the hospital and get my little shower cap, as I call it, on, and a little fanny pack thing so they can record all that stuff. So, but anyways, I hope this helps you out, guys, and ladies and gentlemen, and everybody out there. This is my brain wreck. You guys have a great day, and be strong, you purple epilepsy warriors, and all your other people that have seizure disorders. Be strong. Don't give up. There's hope in everything. And always go check out your epilepsy foundation, your local epilepsy foundations in the area that you live. Also, because they have lots of resources. Also, the hospitals have resources too. You guys have a great day. We'll talk to you soon.